Thank you so much for the opportunity to talk to you. So I enjoyed listening to the other lectures about how we can encourage our patients to be able to kind of be motivated to do the things that matter the most to them. And I think this is a little bit of time to actually have you guys actually think about things that help you to do the great work that you do in medicine. So first things, I have no disclosures, but get your cell phones ready because we will have some audience participation during this session. And also get a pen ready to do some work. Most of you should have in front of you kind of a life wheel, as well as some handouts that we're going to go through some goals that you may be able to kind of set today. If you don't have a copy, there's one in the back. There's a little thing back in the back that you can grab from there. So we'll start with a case. So this is Dr. M, who's seeing Sally in clinic. And she's trying to listen intently to this patient and be able to kind of get through what she needs to talk to her about because Sally's really concerned about the palpitations she's been having. But at the same time, Dr. M is worried about maintenance of certification, ethics, CME requirements, RME requirements. She's lost some of her staff members but needs to see more patients. She has a new clinic nurse that doesn't know her workflow. She has to travel for work to be able to kind of continue to grow her reputation in her network. She has a family wedding coming up. She has scheduling conflicts now that there's new staff and trying to fit in the right number of patients at the same time as doing her inpatient work. She's concerned about RVUs as procedures that she's done have had decreasing RVUs, but her RVU targets to maintain her practice keep going up. She gets her 30th text page. She has a recruiting dinner tonight to try to help with some of the staffing issues that she's been having. She has committee meetings. Her in-laws are coming this weekend. She's in the midst of a home renovation, and if anyone's been there, that's pretty stressful. She has a quality improvement project that she's trying to complete with some learners in her office. There's an EMR upgrade, so she doesn't know where the button is to be able to send the right orders. She sees compliance course that's due with 3 hours of training that she's supposed to fit in when she has over 40 hours of patients scheduled. She has a new leadership opportunity that she's interested in, but trying to find out the way to manage that with her love of her patients. She has multiple offices across the Metroplex, so has to make sure that she has time to get from those different places. Her dog got out this morning and is lost. Her kid is sick and called and said, "You need to come, pick me up." Her patient in the hospital is dying, and at the same time, her mother is dying. So I think these are all things that we can relate to in different aspects of our lives. So being a physician doesn't mean that all we have in front of us is our patients. We also have our own lives and our own struggles, our own opportunities, and our own challenges. And I think it's our responsibility of healthcare system to recognize that we're human and that we need to be able to integrate all of these aspects of our life. So today, I can't get away because at UT Southwestern, my job is to kind of work on the strategies that we do as a system, and we'll talk a little bit about burnout and what the effect is from a systemic perspective on healthcare. We'll discuss the drivers of a well workplace and how to support a culture of well-being, and then we'll move more to the individual aspect, which is where I want to kind of interact a lot with you guys. So evaluate your current level of satisfaction with your life, understand the human basic psychological needs according to self-determination theory and how they affect us as human beings and our success and our opportunities in healthcare. And then explore our professional goals and sources of motivation, and then prioritize your goals and set boundaries to maximize your professional fulfillment. Let me see if I can get online. Okay, so it looks like about 46% of people feel that they're occasionally under stress, but and don't always have as energy as much as they once did, but they don't feel burnt out. But when we look at the kind of other populations, it's about 49% of people that in this audience have a symptom, one or more symptoms of burnout. So let's talk about what burnout is. So burnout, the key to this definition is that it's a work-related syndrome characterized by emotional exhaustion, depersonalization, and reduced professional fulfillment. It's the work environment that makes people feel this way and the conditions in which they're made to work, and not the individual that's the issue when it comes to burnout. People can be perfectly happy in their personal lives, but hate and dread coming to work, or feel overwhelmed when they're there, or just not a sense of connection there. So it's the responsibility of the system to create an environment in which people can thrive. And you guys actually represent the national scheme in our little straw poll here today. So the Medscape burnout study in 2023 looked at over 9,000 respondents, and overall prevalence of burnout with that same mini-Z question was 49%. Slightly higher women at 56% compared to men at 44%. So you guys are right in there with one or more symptoms of burnout. So why we care is partly to care about our patients and the care that we provide. So people that express that they're burnt out are more likely to report a patient safety event, about 2 times more likely than people that aren't burnt out. There's more professionalism complaints against physicians that are burnt out, and there's lower patient satisfaction scores. And when we look from a business perspective, we know that the cost of replacing a physician is 2 to 3 times their salary, and that physicians are more likely to leave when they're burnt out than when they're not. We know that we lose patient revenue, as well as expertise of seasoned physicians when those physicians decrease their effort or leave the profession. We lose practice efficiency and continuity, and we disrupt team-based care. In fact, any member of a team that leaves or is burnt out can actually cause the likelihood of others leaving that team to be more likely, and then further disrupt that care. We lose productivity, so every 1 point increase in burnout is equated with a 30 to 50% increased likelihood of reducing your work effort in the next 24 months. And from an academic perspective, we lose our mid-career faculty. When we put this in perspective, the average age for a first R01 or NIH grant is 44 years old, so that's right in mid-career, which is where the highest peak of burnout is in the profession, kind of 8 to 20 years out from training. We lose our mentoring ability, our national reputation and influence by our ability to contribute to science, and similarly, an increase in burnout is associated with a 15% decrease in academic productivity. And then we talked about the fact that there's more patient safety events and decreased patient satisfaction, and this directly relates to increased malpractice suits as well too. So it has a cost to it beyond just what we want to do as a human to provide the best care we can give. And then we lose that clinical workforce. So we decrease our professional effort, it decreases our access to service for patients. We potentially can increase health disparities as we have decreased access. We can decrease our preparedness for public health crises like COVID-19, and we worsen public health outcomes. So the Surgeon General put out a great piece both on specific to healthcare workers, but then I think also just about a well workplace in general. And what it centers on is the fact that workers need to have a voice and feel like they're equitably represented in their organizations. And it centers on these 5 pillars of opportunity for growth, protection from harm, connection and community, work-life harmony, and mattering at work. If those drivers are ignored, then we see increased rates of burnout, we see exhaustion, cynicism, and inefficacy. If they're optimized, we see the opposite. So we see engagement, we see vigor, we see dedication and absorption. So there's 2 kind of different types of well-being we have. One is the responsibility of the institution, and this was from the National Academy of Medicine's kind of definitions. So personal worker well-being is the responsibility of the system. So it's the presence of constructive conditions at work and beyond that enable workers to thrive and achieve their full potential. However, professional well-being, which is being satisfied with your job, finding meaning in your work, feeling engaged at your work, and finding professional fulfillment, is tightly linked to personal worker well-being, but is also somewhat in your own control and agency. So on a star scale on your thing, my work schedule leaves me enough time for my personal and family life. Let's rate that from 0 stars, or the lowest star to like no, to the highest star, which is completely, I feel, incredibly well balanced. Okay. So a lot of people are somewhere in between, kind of like not the worst balance in the world, not the best, although there are significant kind of 31% of people right now that don't feel so great about their work-life balance. But most of us are somewhere kind of meh, I wish I had a little bit better balance, but I'm somewhere in between. But we'd love to see people more on that I'm incredibly satisfied, or that this is the best balance I could ever have. Why that's important in medicine is it's partly, again, a system issue. So when we look at doctors who actually have higher resilience scores than the general population in other studies, when they look at their burnout, it's higher than the general population, and worse kind of in 2021, right after the pandemic, as shown in the green line on the left versus the blue line for the general population. When you asked about work-life balance, so a group of people that's highly resilient, a group of people that is highly professional, we find that physicians, again in green, show that they are less satisfied with their work-life balance than the rest of the population, suggesting that really it is the system in which we practice that kind of doesn't allow us to perfectly find that balance for ourselves. So we need to do better there. So now it's time. I'm going to give you about 5 minutes to kind of look at the handout that you have in front of you. So one way to kind of moving from the system more to you is what are the things that you do have agency out. And we don't have enough time sometimes to be able to actually assess our own work-life balance and how we feel about things. So what I want you to do is kind of look on that first page is kind of the wheel of life satisfaction. And you can see there's multiple dimensions in which you can feel satisfied. So a score of 0 seems like I feel completely dissatisfied, I need to have more of this. And then a score of 10 is this is the best it possibly can be, and I'm really satisfied with what I have. And obviously a 5 is somewhere in between. So what you'll do is kind of take the next 5 minutes to kind of put a dot on each of those domains and then connect the dots in between each of those domains to kind of make a circle or a wheel. So I'll give you 5 minutes. So I can see we have some fast test takers. So for those that are continuing to do it, continue to do that. But I just wanted to open up the next part, which is kind of taking a look at this wheel. So now if you've connected the dots in between your wheel, you'll have something like this. So I kind of connected all the different scores and different aspects of your career. So go ahead and connect those dots. And once you connect them, kind of take a step back and just look at the overall shape of that wheel. If you were in a car, would your ride be bumpy or would it be smooth? Would it be fast or would it be slow? Because sometimes you can have a really round wheel, but it's really small, so it has to rotate a whole lot to kind of keep up with the pace that you're doing. And then I think there's some other questions, and some of this you'll be able to do kind of after today, but which area of your life would you like to improve versus which area do you think you really need to improve, which can sometimes be the same area, but sometimes are different because we sometimes decide to avoid things that may be a little bit more tricky for us. And what would your dream life, so if you could work or play or do whatever you wanted every single day, there was no conflicts at all, what would that look like in that specific area that you want to concentrate on? And then after you've kind of dreamed about what that could look like, what is the first step you can take, even if it's just a little bit, to be able to commit to that change today? Okay, so kind of as we think about those things and as you're kind of thinking about those issues, this is our next little survey of, in one word, what brings you the most joy at work? Yep, so if you so relevance, that's a great one. Relationships, patience, leadership, appreciation. Patience is really kind of winning out on that. Yeah, connection with patients and with each other. Patient satisfaction, relationships with others, for patients and joy. We know someone who wants to do prayer authorizations on it. I think you could probably make a great business in that. Patient satisfaction, appreciation. So we see a lot of the center to our lives is kind of what we do for our patients, it seems like, and that relationships are incredibly important to us, and so is appreciation. So when we think about this, a lot of this has to do with meaning. So when we look at burnout, I'm part of the Healthcare Provider Wellbeing Academic Consortium, which is a consortium of 26 academic institutions, including Stanford, kind of led by their WellMD Center, that looks at burnout specifically with validated measures as well as measures of things like meaningfulness. And as you can see in this graph, burnout increases as we work more. And we also know, for those that are working lots, just to put it in your head, that greater than 55 hours of work is actually an independent risk factor for morbidity and mortality in the United States. So if you're working more than 55 hours, you're putting your physical health at risk as well too. But when we look at meaning across that, those that have very low meaningfulness are more at risk of burnout and can burn out faster as they work more hours. While those that have the lowest, or have the very highest level of meaningfulness, as shown in yellow, have lower burnout to start, and it's somewhat protective as you work more hours. And I think some of that is because of the effect that we have when we have negative and positive emotions and how they can help us grow in the work that we do. So when we think about negative emotions like boredom or feeling disappointed or doubt or rage or jealousy or feeling insecure or feeling depressed or feeling grief, all of these things lead to something that narrows our thoughts. So we start to feel helpless, we start to feel like we don't have control, we start to feel like we can't make a difference, and then that makes us less likely to change because we feel helpless. And when we feel helpless, then we move to a fixed mindset. So we can't imagine, we can't think about ways to innovate, we can't think about ways to change the systems in which we work or the environment in which we practice. On the opposite side is thinking about positive emotions on productivity. So when we feel content, when we feel optimistic, when we feel joy, when we feel a passion, when we feel enthusiasm, all of those things lead to us having a broaden, build, and transform or growth mindset. So we start to expand our inventory of thoughts. We start to actually build the resources we need to be successful in our work, and we start to advance our personal growth and create more positive emotions that then feed the cycle in a positive way so that we can continue to grow and expand. This also plays into the concept of flow. So flow is an optimal state. If anyone's seen the movie Soul, I have children at home, so I've watched it, and this pianist, when he plays music, he's not aware of space, time, place, anyone around him, because he's so into the music and creating beauty within that music. So flow is really an optimal state in which the individual experiences a sense of effortless concentration and a feeling of being in control, resulting in increased enjoyment and satisfaction with the activity. When we look in healthcare, there are ways to promote flow, but ways not to promote flow is when we have things like pre-authorizations. So we have something that's a low-skill thing, very little challenge, but it makes us disengaged and emotionally exhausted because it's not aligning with what matters most to us. We also can go the opposite way, so we can have increased challenges, like having to fit more patients into a clinic session, or not having enough time with our patients, or not having enough staff with our patients so that we can truly give of ourselves and of our skills. So the challenge now outranks the skills that we're able to bring in that moment. So that can lead us to a lack of personal accomplishment and also contribute to burnout. However, when we can find that proportional alignment between skills and challenges, that's when we achieve flow. And that's where we feel we're at the best and where we can actually continue to improve our care for our patients as well as for ourselves. When we have flow at work, we see that job satisfaction increases, that people are more creative, that they have more drive, and that they're happier. And we see that burnout decreases. We find things that promote flow in healthcare include minimizing unfinished tasks after shift or after work, allowing for creativity at work, so giving some autonomy back to the people that are doing the work in the local environment, finding supportive leadership, having job autonomy, and having high work engagement. While inhibitors in flow include high job demands, emotional dissonance, and high patient demands. So another thing, think about a leader or mentor in your professional life. What qualities made them a great leader for you? Empathy for patients, patients themselves, the quality, empathy, resilience, caring, teamwork. They practiced what they preached. They had transparency and discipline. Empathy is kind of showing up big in multiple ways: compassion for others and work ethics, discipline and success, caring, resilience, wide range of knowledge. They practice what they preach. So we can see a lot of that connectedness to each other, and that lot of support of each other is important to us. We can see that just in this audience today. So you guys know everything that I'm already teaching. So in the PWAC survey, they have something called the Mayo Supportive Leadership Index, and it looks at 9 components of supportive leadership that are validated measures. So they looked across 11 academic institutions at over 5,000 attendings, and they rate their direct leader or supervisor on a scale of 1 to 5, with 1, I completely disagree that this person does this with me, to 5, they're the most supportive person in the whole entire world. So you can look at these things, kind of align with the things that you thought were important. So it's that sense of empathy and connection. So they hold career development conversations with you. Do they empower you to do your job? Do they encourage you to make suggestions for improvement? Do they treat you with respect and dignity? Do they provide helpful feedback and coaching on your performance? Do they recognize you for a job well done? Do they keep you informed about changes taking place at work? And do they encourage you to develop talents and skills? And then how overall satisfied are you with your supervisor or leader? And what they found was what we kind of saw in this audience about when we talk about our best leaders or mentors in our lives, that for both men and women, as men shown in blue and women shown in red, that as you moved up to the higher scores in the highest tertile of supportive leadership behaviors, that people felt more professionally fulfilled, while those that felt unsupported by their leaders were more likely to say that they were unfulfilled professionally. And similarly, people that felt highly supported by their leaders were far less likely to leave their organization within the next 2 years. So there's a concept for all of us that lead, and we all lead both in private practice, in academic practice, in our homes, with our patients, as really this concept of wellness-centered leadership, where the base of it is caring about people always. So showing concern, showing empathy, showing compassion are important to how we lead each other and how we lead those that we work with. Next is cultivating relationships both with individuals and understanding what their passions are, what their obstacles are, what their fears are, as well as with teams. Where are those obstacles? Where are those fears? Where are those passions? And then giving people the autonomy to let them make the changes that are necessary to go forward. And part of that is because there's a concept of self-determination theory that was founded by Dr. DC way back in 1947, I believe, or 55. But there's 3 basic human psychological needs that we all need. So our patients, ourselves, our children, anyone kind of needs that's human. One is a sense of autonomy, where we feel we have choice and are willing to endorse our own behaviors. That we feel a sense of competency. It's that experience of mastery or being effective in one's own activities. And the sense of relatedness, that we as humans need to feel connected and feel a sense of belongingness with others. When all 3 of these basic psychological needs are satisfied, we're more motivated to make changes, we're more motivated to be in a growth mindset, we're more motivated to move forward. So we actually looked at this, unpublished yet, but coming soon, at over 15,000 faculty through the AAMC Standpoint Survey. It's the American Association of Medical Colleges, and we had a response rate of over 57.5% of faculty that were surveyed. And we just took 3 simple questions that were in that survey that reflected these basic psychological needs. So people, again, rated their satisfaction with, I'm satisfied with my autonomy in my department, on a strongly disagree to strongly agree scale. I'm satisfied with my sense of belonging in my department. I'm satisfied with my sense of accomplishment with my day-to-day activities. And what we see is that when we take that mini Z burnout thing, again, that you guys took today, the people that have none of their psychological needs satisfied, as you can see in the lightest blue, are unlikely to have no symptoms of burnout and far more likely to be having burnout that won't go away or completely burnt out. On the opposite end, however, if people endorsed 3 of those basic psychological needs as being satisfied, they had an incidence of burnout in those 2 top categories that was less than 4%. So if we can find that joy in medicine, that we can find that sense of connectedness, competence, and autonomy, we can find a way that we feel like we're satisfied and we're more motivated to continue the change. So when we think about motivation, so this is the next, we're getting real close to another part for you guys to do the work for yourselves and to kind of learn more about you. Is intrinsic motivation and extrinsic motivation are kind of the 2 types of motivation that work in kind of our daily lives. Intrinsic motivation is doing something because it's inherently interesting, aligned with personal values and purpose. So it really comes from within about why we're doing something. It's not because someone's asking us to do it or not because someone expects us to do it, it's because it's what we want to do. These are things like passion and interest, curiosity, enjoyment, purpose, and fun. There are extrinsic motivations, and they're not bad, but they are things that we do something because it's something we ought to do, or because it's something that will lead to an outcome that's positive for us. So it's external things to us that are making us do something that we need to do. So it could be money, praise, rewards, our views, grades, punishments. All of those things can affect our relationships, our academic success, and our career success. When we think about financial incentives, which we use a lot in medicine, because we pay for performance, we pay for our views, we pay for a lot of things, they're actually reasonably good for things that are just quantity-based. So not quality, but more quantity-based. So as you increase the amount of payment you give someone to do something that has a thing that you can count, like vaccinations in children or vaccinations in a clinic, you see that people increase their performance based off of if they're getting paid for it. And if you have someone that, with that vaccine example, as you can see in red, I can take that financial incentive alone for someone that already has an intrinsic motivation to protect our children against preventable diseases. So I can take that baseline, I do this because it's what I think is best for my patients, and what I intrinsically want to do is to protect people against disease, and make us more prone to getting those numbers perfect and optimizing our performance within our clinic, so that we also have a financial incentive to it. But there is this concept of crowding out. So sometimes if the incentive doesn't match, the payment doesn't match something that intrinsically is important to us, then we start to actually underperform. There was this great study in blood donors that were frequent blood donors to the blood bank. So they gave every month consistently because they wanted to give back to people and they wanted to help save people's lives. They took that same group of people and randomized some to continuing to do that behavior, and then others to getting a $50 payment each time they donated. And what they saw was the people that were getting paid for their blood donations actually started to donate less. And it's because they took away what was valuable to them. So instead of being because I want to save people's lives and because I want to donate to society, it was because I was getting $50. And so that kind of decreased the incentive for these people to actually donate and change their locus of causality. There is a point where you can get that payment to kind of overcome that and get back on that line, but the opposite is the other end of it. So there is a point where we start to break down that connectedness, that sense of performance anxiety that we can get. So there's another great study in college students where they had them do a Rubik's Cube or a puzzle like that. And the kids liked doing it, and they were doing it well. And then they had teams kind of working on, they could work together, they could work separately, they could do whatever they want. So then they offered, if you solve this puzzle in the shortest amount of time, we'll give you money. And what they found was that one, the kids took longer to do the puzzles, and that teamwork decreased as you started to add these incentives. So again, when we have higher cognitive things that require quality, financial incentives and extrinsic motivations can distract from the reason that we're doing things and our performance in doing that. So another 5-minute exercise for you all is just to take time. You can see that there's things to kind of write down 3 professional goals that you have currently. So examples for me were I will get fingerprinted for my medical license renewal. I have to get fingerprinted for my medical license renewal. The next one was, I'll optimize my clinical scheduling to improve patient access while allowing me the flexibility to participate in important administrative activities, as well as be present during my son's last few years of high school. And then my last goal, that's kind of my overarching goal, is I will be a passionate advocate and change leader in creating a culture of well-being in healthcare to bring back meaning, purpose, and passion to the field of medicine and positively impact the lives of patients, the community, and the healthcare workforce. So kind of those are 3 of my goals, kind of around the spectrum. So take another 5 minutes and kind of think about 3 goals that are important to you right now in your professional practice. We have fast people. You must think about your lives a lot, which is good. So again, keep working on those as we go. I just want to talk a little bit about how we look at motivation and how that aligns with those basic psychological needs of autonomy, competence, and connectedness. So when we look at types of motivation, they kind of lie along the spectrum. So first is amotivation. It's when there's no consequence to me not doing it, and I have no desire to do it. So I don't want to get a tattoo, so I'm not going to do it, even if my kids ask me to, you know? So it's kind of, I'm going to be inactive towards it. I'm not going to do what I want. It's my kids loading the dishwasher is another example. Sometimes they'll be completely oppositional. And there's that insecurity, failure, and resistance or apathy that happens. And it starts to put us more to a fixed mindset. So even if we wanted to do something along that spectrum, if the motivation was slightly different, then we could reframe that motivation, I may be willing to do it, but as soon as you get me amotivated, I'm likely to do anything with it. The next is kind of looking at those extrinsic motivators, or the must-ivations. So the things that I feel like I'm going to be punished or rewarded or threatened or praised because of. I feel a sense of tension and anxiety. I'm less likely to be engaged. I'm less likely to persist, and I may feel dissatisfied with it, but I do it because I'm supposed to do it. The next thing is introjected motivation, which is things that I feel like I ought to do instead of want to do. So maybe it's exercising 30 minutes a day, 5 times a week, getting up at 5:30 to do those things, finding those times. And if it's something that I'm not like thrilled about and I don't have those intrinsic reasons to do, I just feel that pressure that I should do it or I ought to do it. The next kinds are kind of our intrinsic motivations or our autonomous motivations. So these are the wantovations. They're the things we want to do. So it can be that actions, it's usefulness or value driven. So the actions drive values or alignment, need or relevance, or they're interest driven, that I'm really interested in doing these things. And this is why I do it, because it's so much fun to do it. I love it. It makes me feel challenged. I feel a sense of volition, pleasure, energy, persistence. Is the area of deep learning and growth mindset, enhanced performance, satisfaction, and gratification. So now taking your own 3 professional goals that you have, will take about a minute and a half or 2 minutes to kind of now look at that. So you have the little chart that I just showed kind of on the second page to just remind you what it is. But rate on a scale of 0 to 10 each of your goals. So as you can see, for example, the one that was I will get fingerprinted for my medical license renewal, my intrinsic motivation and identified motivation scores were pretty slow. While my introjected and external motivation scores were relatively high. So you can kind of do that for each of your 3 goals. So again, I'll give you 2 minutes to kind of do that. Okay, with 30 seconds to go, we'll kind of talk about why that's important in the concept of self-concordance. So self-concordance is a state reached when goals are aligned with our individual sense of self, needs, and personal values. So more intrinsically motivated than extrinsically motivated. And why this is important is when we do things because we want to, and because it's important to us, we're more likely to sustain our effort towards achieving that goal. When we achieve that goal, we feel a sense of higher personal satisfaction and psychological happiness. And when we see that, we can see a change in our own well-being, which then makes us more likely to take on another goal that's intrinsically motivated, that's even more challenging to us, and kind of is a virtuous cycle of us getting more and more motivated to achieve our goals. So now with that same set that you have each of those things, take the two columns that are intrinsic motivation, so intrinsic and identified motivation, and sum those together. And then take your introjected motivation and external motivation for each of those, taking across the row and summing that. So for me, it's 2 + 2 is 4 for my intrinsic motivation score, and 8 + 7 is 15 for my extrinsic motivation score for my first goal. And then you subtract intrinsic minus extrinsic motivation. So for my first goal, I have a self-concordant score of -11. So again, I'll give you guys kind of 2 minutes to do that little bit of math. Okay. Now the most important part, and this is a little more interaction, although definitely things you can take home with you. But now I'd like to kind of turn to the person next to you or behind you or in front of you and kind of pick one of these questions to kind of now look at. Now that you look at your scores, you know, which ones are more self-concordant? Are most of them self-concordant or are most of them self-discordant? How can you prioritize the goals that mean the most to you? How can you reframe those goals that are less aligned with your meaning and purpose to help foster growth mindset? So, you know, an example with that is that fingerprinting. So completely not something I want to do and I need to find time to do it. But if I reframe it in the sense that getting my fingerprint allows me to keep my license, which then allows me to be able to take care of patients in a way that's meaningful and help to prevent cardiovascular disease in the population, that puts a little bit more like I need to prioritize this on my list. And then how do you set boundaries and to improve your satisfaction with your work, and who can support you in finding meaning at work? So turn to your friend, to your neighbor, and kind of talk about that for about 5 minutes. Okay. It sounds like people have found ways to kind of think about, it's interesting when you have time to actually think about why you do the work you do and kind of think about what you're doing and why you're doing. And I think that's, I can tell there's lots of positive vibes in the room when I kind of hear you guys talking. So it's definitely something that's kind of worth taking with you from here. So bringing out that life satisfaction wheel, once a year or once or half every year, kind of taking the time to write down your goals and understand your motivations can definitely help you to kind of foster that growth mindset and make sure that you're adhering to the most important thing in medicine, which is your ability to do what you came to medicine to do. So in summary, burnout is associated with medical errors, decreased patient satisfaction, decreased professional effort, turnover, and potential risk to appropriate staffing of the healthcare system nationally. System improvements that provide a psychologically safe growth mindset, empowering and supportive culture are most likely to foster professional fulfillment and are essential to the changes that we need. Supportive leadership behaviors, employee engagement, and local physician involvement in creating the system that we want can foster professional well-being. But equally important is taking the time, because it's important to you to still continue to be the leaders in healthcare and to be there for your patients and provide the best care. It's for you to take time to look at your life satisfaction, to understand both the intrinsic and extrinsic motivators in your life, which can help you prioritize your work that is aligned with your values and purpose and provide you more joy. Thank you for your attention.
Any questions? Fantastic talk. Thank you so much. I'm just curious. I'm on a lot of Facebook groups for physicians, very active on social media, which my husband's not too happy about, but I am. A lot of, for burnout with physicians, and I'm just curious, I noticed you're with UT Southwestern, I used to be with UT. I notice a lot of these programs are called provider this, provider that, and that causes a lot of burnout and feelings of, that's something that, I'm very professional satisfied, but what triggers me is when I'm called a provider. And I'm just curious, I noticed you said I'm the head of the provider. I think names matter, and acknowledgement that we are physicians is important. So I'm curious, why was the name provider chosen for your program?
So no, from our program, it's faculty wellness. So our program is,
So it's not just for physicians?
it's for all faculty, because honestly,
Okay.
we're burnout in and PhD faculty is not as rampant as in physicians, but is equally present in academic medicine for similar stressors that are because of the environment in which academic physicians and PhDs have to provide.
Just with the, with Dr. Fuller talking about, scope of practice issues with Texas, and I was at the TMA conference last weekend. It's an issue, and I think with administration lumping physicians, NPs, PAs together, and then ultimately physicians are being replaced by NPs and PAs, but we're asked to supervise, train, and then we're getting replaced. I think that's causing a lot of burnout amongst physicians nationally. So just wanted to speak to that because I know at UT, this is what's curious that, I've been in practice for over 20 years, and if you look at medical 25, it's just amazing how quickly this terminology from physicians to providers has occurred. So I go everywhere. I'm constantly correcting people, say physicians. So I think that's causing a lot of burnout from physicians, and we're not even called physicians or respected as physicians anymore.
Yeah, I think that's definitely a thing. I can tell you that there's burnout that happens to advanced practice providers, there's burnout that happens to our medical assistants, there's burnout that happens to our janitorial staff. In my role at UT Southwestern, my role is to advocate and support our physicians on the clinical side of my job, and on the non-clinical side of my job, it's to support our PhD faculty. So yes, I agree. I think it's different advocacy. I will stand up for the physician always, kind of in that environment.
I have a question. Thank you for your talk. Looking at the root causes of burnout, what we see is insurance regulation, EMR, what they're intended to be. It's actually put more burden on physicians. Also, our professional societies have not helped us. I hate to say it in terms of MOC, CME, et cetera, it's more burdensome. So we have these burnout lectures in hospitals and all these events for the past 10 years. But what is being used to address the root causes? I don't see the AMA helping. I'm out of the AMA. I don't even join into ACC PAC. I'm a member of the ACC. And the hospitals, they talk about this all the time, but they have incongruent interests with physicians. They're always, seems like they're trying to screw physicians over half the time.
Yeah.
So what is being done? Because I don't see the root cause being addressed. We talk about this all the time, but I don't see any points unless the root causes are being addressed. So please comment on that.
Yeah, I'm on the board of directors with the Dallas County Medical Society and also part of the Texas Medical Association. As Dr. Fuller had spoken earlier, I'm not sure if you heard, they're actively trying to help with many of the issues you're speaking to.
Yeah, I understand that, but if you look at every year, what has changed? So big thing for physicians in private practice, patient copays. There's always an argument at the front desk, but nobody regulates the insurance companies. I have an idea. Why not have the insurance pay everything, have the patients get their, pay their copay to the insurance company? Nobody suggested that. And no matter how much we do, it seems like the biggest driver of all this, and I wish they would just openly say it, CMS has no money. And that's the biggest reason why we have all this regulation. Same, why do we have the EMR metrics? Insurance companies don't want to pay physicians. That's the bottom line. So I mean, that's what I see. The way the EMR is, you have to enter all these metrics because why are there 3 clicks on the EMR to do smoking cessation? And every visit. And why do you have to ask to review systems on every daily progress note? You don't need to do that. It's inefficient.
So I think there's some good things with that, but I agree. Some of it is trying to find leverage technology and have corporations, including Epic, as a big provider, and other EMR corporations to be responsible for making it actually do the process. So it's not just the physicians and their local EMR teams, it's actually the corporations that are selling us to us as consumers to make it work the way that we see patient care. So 100% agree with that. I think there are, you don't need a review of systems if you do time-based billing now in outpatient settings. It's complexity, it's medical decision-making instead, so it's really our assessment and plan. And that was the AMA, that was local medical societies kind of advocating to Congress, at least for Medicare and Medicaid billing. So I think there have been changes, they're small, and you're right. How much the government can necessarily do, it influences the players, but it's a business issue, and that's the difficult part when we're in a business to help people and to care for people and their health. So, agreed.
Thank you, Susan. It was a great conversation. I understand the frustration that we are feeling here, but I think the questions that were being asked are beyond the scope of your presentation. I really appreciate the handout that you gave us. I want to see what your thoughts on how this circle should look. Do you have any idea? Mine looks like a roller coaster ride. Up and down and up and down. Do you have see how it should look, to see that we are content with what we are doing, or
So I think it's a little bit, some of it is about yourself. So sometimes if you truly have a roller coaster ride, that one's a 0 and then it's a 10 and then it's a 7, I mean, you're not going to make any forward progress in your overall satisfaction if it's like that. But if you have a 6, 8, 4, 7, 8, it's a little bumpy. Sometimes that roller coaster ride is what gives us joy. So a little bit is defined by how we find joy in our lives and consistency.
I have one last question, and I think it's simpler than all the questions that have been asked. I love your Venn diagram with the intrinsic and extrinsic motivators. My issue is I'm usually 50 or 60 charts behind with charting. So how do I convert my extrinsic motivation to intrinsic motivation when I hit my computer to start charting those 100 charts ahead of me?
Yeah. Some of it is, and the real answer is having technology be able to do that part of it so that we don't have as much documentation, so 100% agree with that. The other part is sometimes reframing. So it can help if you look at your notes to kind of see what are you doing because you feel like you have to versus what are you doing because it actually impacts your patient care. And sometimes we can find ways to streamline what we're writing or how we're writing it when we can get to that point that this is what's important or not. Or then to talk about team-based care, because there are places that we can expand scope of people to kind of close things based off of what's already documented, but we have to be willing to kind of let go of the stuff that's not important to us and not aligned with what we want to do, and to reframe some of the stuff that we kind of have to do, but it is aligned with giving the best patient care we can.
Thank you so much. It was wonderful.